Hey everyone, welcome back to my YouTube channel. If you're new here, my name is Sam Patel. I have many years of experience as an aesthetic medicine consultant. I'm going to be giving you my honest opinions on Dr. Mike's YouTube video, The Many Lies About Ozempic.
So if you've been on TikTok or Twitter as of late, you've seen this new drug Ozempic be mentioned. I've actually seen Elon Musk tweet about it. It's been covered in the New York Times. It's literally everywhere.
The hottest topic right now, Ozempic. Last year, it was just starting to gain its momentum. This year, I think we're gonna see a lot. So I'm not surprised that good old Dr. Mike is creating a video. I'm very curious to see what he's got to say.
The truth when it comes to Ozempic. For those who don't know, Ozempic is a medication that's been FDA approved to be used in patients who have diabetes to help control blood sugars and, as an added effect, decrease the likelihood of major cardiovascular events.
I'm glad you pointed that out, actually, because I think a lot of people out there that are just now recognizing what Ozempic is have no idea what its actual original purpose was. It was to treat type 2 diabetes and to, once again, reduce major cardiovascular risk in events.
And have increases in weight loss. Because of this added effect of weight loss, many people started using the medication off-label for just weight loss. The pharmaceutical company decided to take the same generic medication found within Ozempic, called semaglutide, increase its dosage.
It's definitely very reminiscent of like Botox, right? When Botox first came out, people used to inject it for migraine pain. A positive side effect was that people's wrinkles went away. And then they're like, hey, why don't we use this medication for cosmetics? Almost has a very similar storyline as Dr. Mike is kind of walking us through this, is that Ozempic and all of these medications were used for one purpose, and then a side effect was, hey, these people are losing weight. So of course, the big pharma companies, as they do best, figured out how can we make money on this
and repackage it under a different brand name called Wegovy and seek FDA approval as a weight loss medication to be used in conjunction with lifestyle changes for individuals who are either obese or overweight, but also who have one weight-related diagnosis, like hypertension, high cholesterol, etc. And after so many people started getting Ozempic prescribed for this off-label use for weight loss, it exploded in popularity, mostly on television and on TikTok.
I love two things that he's done. I love every single time he says weight loss, he goes weight loss. It's just a subtle jab to the people out there, so that's fantastic. And then the social media, of course, if you want to get something to gain popularity, what do? You post on social media.
With people claiming that they've lost huge amounts of weight, talking about their successes. And as a result of all this publicity, there was literally a run to doctors to prescribe this medication for them off-label in order to help them with their weight loss.
That's exactly what it was. It was not just a run, it was a flood of people. I think as soon as this became mainstream, I'll do what Dr. Mike is doing, mainstream, and it went completely viral on social media. He's absolutely right. Everyone was flocking to their nearest provider and saying, hey, I need this medication, I need this shot, the weight loss shot, which is another term that I love hearing.
Which unfortunately ended up creating a shortage, which puts people at risk who desperately need the medication because they have a true diagnosis of diabetes and are not using it for off-label uses.
That's unfortunate, actually. I know a lot of great colleagues and friends who actually use this medication for their diabetes, and they've had trouble getting this medication because everyone's using it for cosmetic use. And that's kind of sad. When it comes to treating diabetes or looking better, I think we can all agree which one's more important.
There is a huge rise of misinformation happening at this very moment that we have to fact check. This claim is patently untrue, and anyone saying this has a terrible understanding of how Ozempic semaglutide actually works. This medicine actually works as an appetite suppressant that slows or delays gastric emptying.
This is beautiful. I love information and education, and the fact that he's going through these details, I actually respect that, because a lot of people think, hey, I'm going to take this injection and my fat just dissolves away. Absolutely false. It actually, as he's mentioning, slows down gastric emptying. What that more simplistically means is that it keeps your stomach full longer. And what that further means is that you eat less because you feel full quickly and you feel full for a longer amount of time. Hence, you intake less. And if you intake less, as a result, you lose weight because you're not eating as much.
Therefore, you feel full and you have less of an appetite. So it's more of an appetite modulator, leading you to consume less calories,
there it is.
Therefore losing weight. Not, oh, I can eat 10 pizzas and take this medication and not absorb the calories. You see how there's a very important difference here? Because if you eat a lot of food and take this medication that slows your gastric emptying, it's going to make you feel worse and you're going to have more side effects. More nausea, more vomiting, more potential diarrhea and constipation.
Which are all the side effects. So the major side effects are exactly what he just said. Nausea, vomiting, constipation, diarrhea. These actual side effects can be managed properly if patients are taking it, of course, at the recommended and the appropriate dose, but also if they're eating properly and not stuffing their faces.
People are actually talking about these side effects who are eating their normal portions or even eating reduced portions. So imagine if you were to overeat thinking you can while taking this medication. That's a cause for concern. This claim is starting to spiral out of control.
So the claim is most weight loss while taking Ozempic comes from muscle loss. I'm very interested to hear this because this is where I actually have a keen interest in, is the muscle component.
Because it initially started with some simple observations that doctors made of their patients who were losing weight on Ozempic or Wegovy, and they were seeing that those patients were losing body fat, but they were also losing lean muscle mass.
Sure are.
This is not surprising because the way these medications work is by suppressing appetite, therefore having the patient consume less calories. Anytime you're going to be consuming less calories, you will both lose muscle mass and body fat.
That's very important. Most people don't recognize that there's multiple types of weight. There's fat that contributes to your weight. There's water that contributes to your weight. There's muscle that contributes to your weight. And all of these are going to be impacted at some way or in some way with this medication. Of course, the intake of food being less is going to have less calories, hence lose fat. But it's also going to decrease proteins. And as such, when you're not eating protein, your muscles have nothing to continue building themselves, or at the very least maintaining themselves on. And then also dehydrates patients because they're wanting to consume less. Hence, they become dehydrated because they don't feel the urge to drink water.
Obviously not ideal, but with this type of medication, that control is limited. But we do have control. Any good doctor should not be just prescribing this medication and forgetting about the patient. You're supposed to be getting the medication and having the doses slowly increase based on the effects and side effects that we're seeing. Also, it should come with a plan for nutrition, possibly meeting with a nutritionist who can help guide you.
Dr. Mike, he doesn't just have dashing good looks. He's got some intelligence as well. This guy's onto something. I think that Dr. Mike is putting it perfectly. You can't just give medication and expect patients to have amazing results. They need to have a proper plan. And we're seeing so much of this in a negative way. There's like these medical weight loss injection clinics where you go in and you get an injection and you walk right out. That is frightening.
How much protein you should be taking in, despite the fact that you're consuming less calories, and a plan for exercise that includes resistance and weight training to help keep on some of that lean muscle mass.
Absolutely. We have to make sure as we're losing that fat and as we're losing that muscle mass, we have to get patients to do something about it. They need to do resistance training or weight training or go swim in a pool to help keep that lean muscle mass. And if they can't because maybe they're too overweight or perhaps they have injuries or are debilitated for whatever reason, there's other great technologies out there that are non-invasive. Lean muscle mass is super important for longevity and definitely has to be talked about, as Dr. Mike is talking about it right now.
This is the one where I'm seeing the most examples of on TikTok. Someone saying, oh, I took Ozempic for a wedding and I lost 10 pounds. Look how great I look. This is not what the medicine was intended for.
No, it's not.
In fact, people who are already of a healthy weight looking to get skinnier were not the ones that were studied when we were checking the safety and effectiveness of this medication.
Yeah, this is the unfortunate part about this medication is people are using it strictly for vanity now. We're seeing a lot of models do a crash course dosing of this medication for weddings like he's mentioned, and that's not how medications are supposed to be used ever. This is a medication. I think people forget that. They think it's just a quick injection. This is a prescribed medication.
So maybe taking it while you're already at a healthy weight can lead to worse side effects. And the worst part of all of it, once you stop taking it, the weight will come right back. This type of yo-yo dieting has been associated with numerous health risks, including returning to your normal weight and then going past
I love
it.
that. Yo-yo dieting. It's so correct. Patients will think that this is an instant quick fix. And what are they doing? They get on this medication, lose weight, but guess what never changed? Their bad habits. They still eat like shit. They eat fast food. They eat terribly. So although the medication got their weight down, they never changed the actual reason for them gaining that weight. And that was their lifestyle. That was their habits.
Going past it and gaining even more weight after you stop a medication like this. Anytime you have a rapid type of weight loss, what can happen is you lose the subcutaneous fat that's present in your skin, especially if in your 30s or 40s. And as a result, you can develop this hollowed out appearance to your face. Now, if you're taking Ozempic or Wegovy
this is
the
very
correct
important.
way, this shouldn't be happening. My suspicion is the people who are experiencing this quote unquote Ozempic face or this hollowed out look are individuals who are rushing to lose weight, using it in a way that is not being prescribed to them, because when doctors prescribe these medicines, they do it with a titration mindset.
We're seeing that so much, this Ozempic face or Ozempic butt, where fat, we want to maintain it. We want to keep our fat in our face. Many individuals, specifically women, want to keep fat in their glutes or in their butt to maintain the volume. As he's saying, when people are using this medication improperly or they're titrating too quickly, we're going to lose fat in those areas, in the face, which makes people look skinny and gaunt and look almost sick in an appearance. And then further, they become having flat butts. And so we also not just eliminate a problem with fat, but then we create another problem with then losing volume in other areas.
Meaning they start low and they slowly increase your dose while monitoring how much weight you're losing, how many side effects you're experiencing. Ideally, what doctors are looking for is for a continued 1 to 2 pound weight loss per week. Obviously, that varies depending on your own individual situation, but certainly not the 10, 15 pounds in 1 week that people are claiming they've lost on these medications when they're using them in a non-prescribed, uncontrolled way.
Very important. Non-prescribed, uncontrolled way. That's unfortunately a lot of the practices and business and clinics out there that are now saying they do medical weight loss out of the blue. This is a problem. They don't know how to dose properly. They don't know how to properly monitor. If you are getting into a program for medical weight loss and they're having you be seen once every 60 days or once every 90 days, that should really scare you. That should scare the shit out of you. Why? Because this is a medication, and as Dr. Mike's saying, we need to monitor these patients weekly, if not monthly, at the very least, with of course doing blood work and seeing their weight be lost in a controlled manner.
I don't think GLP-1 medications should be first-line treatments for those who need to lose weight.
I agree.
Anytime you're prescribing a medication, there needs to be a risk-benefit ratio done for the individual sitting in front of you. And ultimately, the individual needs to decide if the medication is right for them.
Correct. There has to be an assessment of risks and benefits. A lot of patients need to have a proper evaluation and a proper consultation to make sure, A, why are you doing this? What are your goals? Because if it is to lose quick weight before a wedding, it's a clear-cut reason for this medication not to be prescribed to them. But also making sure that they're going to do it in a controlled fashion over a series of weeks or months, because it needs to take some time to do this safely, not acutely.
And while these medications have shown promise for individuals to lose 10 to 20% of their weight if they are overweight or obese, it's still important to factor in that there are legitimate risks to taking these medications.
Yep.
There are side effects. People have GI issues, nausea, vomiting, diarrhea, constipation, pancreatitis, kidney issues. There is a potential issue of increases in thyroid cancer long-term with these medications. And these these are not reasons to not take the medicine. These are reasons to think about this medicine as a tool in our arsenal to help patients reach their desired weight.
I love using the analogy of having a tool in your toolbox or a tool in your arsenal. And that's exactly right. You have to have this as an option. It could be with medical weight loss, dieting program. It could be with exercise. It could be with changing what you're eating, or it could also be with bringing a medication like this on board, or all of it. But it has to be an option of many, not the only option.
And when we talk about their desired weight, that talks about a healthy weight. To me, I feel like this whole conversation has caused us to lose sight of the big picture. With the exception of an individual who's facing harsh socioeconomic standing, someone who has a legitimate medical condition like diabetes or a thyroid condition, among the many others that cause increased weight loss or weight gain is under our control. There are things that we can do, and I could recommend as a doctor to help someone lose weight when it comes to a nutrition standpoint, a fitness standpoint, sleep, mental health, etc. When I think about my patient's health, I don't just think about their weight.
Everyone else should consider having a similar mindset as he does. It can't be just solely determinate on one's weight to figure out what their health is going to be like. We have to see all the factors. What are they eating? What's their job? How is their activity level? All of these things, of course, also medically. What contributing factors have gained their weight? Is it hormone imbalance? Is it a thyroid issue? What is it? Is it genetic? We need to figure out what the issues are. Can't just throw medication at someone and hope for the best.
It's not the sole determinant of one's health. And when it comes to improving someone's lifestyle, we're not only lowering the weight, we're also improving their quality of life, decreasing risks of certain cancers, other diseases, and ultimately extending and prolonging their lives.
That's exactly what these medications are intended to do. They're there to help prevent chronic diseases from developing or progressing if they have it, such as diabetes, such as, of course, cardiovascular disease. And our goal for these medications is exactly to reduce the weight, because then as a byproduct, we're going to keep them living healthier and longer and preventing disease with the kidneys, the heart, the brain, whatever it may be. So yes, the intention can't just be cosmetic. It has to be so much more, because that's why these medications were designed.
That's what being a doctor is about, not just focusing on the scale.
There it is.
I actually had a patient whose doctors said all of their symptoms were due to their weight. And I actually found that wasn't the case at all. Click here to check that out. And as always, stay happy and healthy.
Good old Dr. Mike. You know, I haven't really watched Dr. Mike to this length ever. I just know that he's the guy that a lot of women craze over, because he is obviously very fit and very good looking. To each their own. But you know what? Behind those good looks are also some good opinions and good thoughts. So I appreciate this video from Dr. Mike. Looking forward to hearing more from him. And for you guys, I would love to hear what your thoughts are about this video, about some of the thoughts and discussions that I had about this video. I would love for you to post them in the comments so we can discuss it a little bit more. And I appreciate your support. Definitely, if you haven't already, make sure you click subscribe at the bottom. And I look forward to having more discussions with you really soon. Take care, guys.